The world at large has faced a major health crisis post the COVID 19 issues. There has been bombardment of a lot of bad news everywhere around. There has been fear of social isolation. There's been a lot of uncertainty about the future, about the health of our loved ones, about us, about a lot of uncertainty about the financial conditions. It has precipitated into a lot of psychological trauma into people's mind, which has also precipitated sometimes as mental health issues.
With the preventive measures such as physical distancing and isolation has increased anxiety about COVID-19 in a lot of patients. Anxiety about COVID-19 and its health issues has exacerbated a lot of fear, concerns, sleeping issues, and extra.
Post COVID 19 crisis, the world has faced a lot of issues. There has been a lot of fear, a lot of fear about social alienation, there has been a lot of psychological trauma in general.
Mankind has really experienced such collective sense of vulnerability. In India, due to COVID-19, every 4 in 5 patients is having some or the other mental health issues. Currently, around 459 millions of the world population is suffering from mental health disorder.
Corona pandemic has been stressful for all of us. There has been a lot of fear and anxiety about the new disease. There has been anxiety about what are the symptoms, to know about if our loved ones can contract the illness and how we will cope with this. It has developed a lot of emotional turmoil and strong emotions amongst children as well. There are measures which are required to stop and to prevent the corona spread, such as social distancing. A lot of cases we've seen in our clinic practice who have anxiety and also have psychological issues when they have to practice social distancing. It has made them feel isolated, lonely, a little anxious when they cannot relate with other people emotionally and may not be available for them. Though these measures are important to prevent the spread, but it has also increased a lot of emotional problems among the people. So, here in this video, now we will share some of the important tips which can help us to be available to take care of ourselves, to take care of our loved ones, and also as a community to be more stronger and healthier. We will discuss few tips which will help us to deal with this emotional turmoil during the time of pandemic.
Handling emotional problems. At the time of anxiety, practice breathing. Take inhale and exhale slowly over a few minutes. Counting backwards from 10 to 1 helps you to distract. Third, even when feeling afraid, deal with it by asking yourself, what is under my control? Am I unnecessarily worrying about the worst thing that can happen? When I have been stressed in the past, how I have managed? What are the things that I can do to help myself and stay positive? Fourth, feeling lonely and sad is also quite common. Stay connected with others. Communication can help you to connect with family and friends. Call up people whom you haven't spoken and surprise them. Discuss happy events, common interests, exchange cooking tips, and sharing music can be a more pleasant activity. Fifth, any of these emotional persist for several days despite you trying to get out, talk it with someone. If the feeling worsens, a person may feel hopeless, helpless.
Taking care of your friends and family is a very good stress reliever. But at the same time, we have to take care of ourselves. A lot of times, social distancing is a required measure to prevent illness. With a phone call or a video chat with your friends on a constant basis can also help us to relieve the stress.